Roma in Western Queensland, and it's a lovely rural little town, about nearly 600 k's west of Brisbane. And my clinic name is Roma Therapeutics, and I've had my business operating since 1989, so quite a long time in doing stuff. My background is that I'm a midwife and registered nurse, and my main client base that I see is a lot around rehab from injury or surgery. And so in that domain, a lot of multi-sex, male, female, children, everything. And then obviously with the remedial massage, a whole range of age groups. And then from the midwifery knowledge and skills, I obviously get quite a large client load of mums and bubs coming in. And with the introduction to doing the scar therapy, I did that one bit of training with you a couple of years ago now, and I'd done some training many years before when I was doing some kinesiology training, but doing your introduction stuff was similar, but so much more than what I'd had before, and so I wanted to obviously learn a lot more. And then doing the mastery course with you obviously fulfilled that. Thank you very much. And so since doing that with you, my main focus was really for the mums post Caesar, to help with the difficulties and stuff they were having, or nerve pain or other things with healing. And it just kind of expanded really from that. I had a few clients in, and then I put a notice up out the front of my clinic on the little blackboard I have out there that just said, now offering scar therapy. And by the end of that day, I had 25 new scar clients. So, and they were from a whole range of stuff, none of them postnatal women. So it's just kind of expanded now for me to a whole range of different things.
You did your lovely case study on your husband, and it was a very good demonstration in the global effects of scar therapy. Do you want to just explain a little bit about what happened there?
He had dehiss of his rectus abdominis, and doing manual work and stuff, too much lifting. But he also had shoulder reconstruction repairs, a wrist fracture and tear of a ligament, and had that. So he has lots of other scars or everywhere else, but particularly with his abdominal, he was getting a lot of lower abdominal pain, a lot of back pain things. But lead up to doing the techniques on him for my case study, I got him to sort of like just stand and do a bit like the scarecrow technique, I suppose, standing up to see, how far can you, what's going on. Well, he couldn't sort of get very far with his lifting of his arms because it was, painful, but also he just couldn't lift them up, and that restriction obviously in his lower abdomen. Not that we kind of acknowledged that and talked about that when he did it. I just said, let's do a before picture, and he just kind of did the standing there. Then after we did the techniques on his, now I literally only did them on his direct abdominal scar, and then some planing on his lower abdomen and pelvic area, and that was it. Like, I didn't do anything on his shoulders, anything on his neck, anywhere else, just purely that area of abdominal region totally. And after we had finished that, we stood up again, and I asked him to just literally put your arms out again, and it was just like, he was like straight up, and just the whole visual change of what was happening for him. So even though we hadn't done anything in those other areas that you could see were rolled and contracted, just releasing that whole abdominal area actually changed his whole structure of how he was able to stand. And yeah, and I think he was probably as, you know, surprised as I was. And yeah, like, I mean, it's probably, you know, I've been doing a few case, you know, study things myself. I'm not so good at research. I did pass it at uni, but it's not really my thing. But yeah, like, you know, just looking at some things that have only been short term, whether it be, you know, from an accident or surgery and so forth. But even have had a person recently, they had a tumour on their neck. So this person has a scar that literally goes right around except for one little space there, and a lot of pulling on one side and everything. And they come to me purely because they were getting a lot of neck pain. So basically doing the same thing. And I've seen that person for the second time the other day, and they've not had any headaches since that first treatment I did. So I did do scar, and I did do a little bit of, you know, soft tissue release remedial work as well. But majority of the work was the scar release work. And this person has been dealing with that stuff pretty consistently. Well, probably for at least a good 10 or 15 year period. On and off, and obviously the last, you know, number of years has been quite constant with migraines and different stuff like that. So yeah, just changing that, but even changing the slight appearance of what was happening with the scar after that first treatment as well was a big thing as well, because obviously, you know, it's come, so where you're wearing different type of clothing, you might always wear collars instead of wearing, so that's what I noticed too, the change in the type of outfit they were wearing the next time they come, you know, just in that of being more comfortable about your scar being seen and things as well, is some of the things that I've noticed with some of the clients. If it's been a very visual type of scar, you know, like from a sun cancer or surgery or things like that we've done a lot of work for, yeah, the change in, instead of wearing a load of makeup to keep trying to cover it over, sometimes I've seen that those type of things have reduced for people in just their own acceptance of general appearance of what their scars might look like.
And you touched on a really interesting thing there, that you were able to combine your scar therapy with your other skills and modalities that you use in your practice. Has that been something that was an easy transition or just naturally happened? How did that all come about?
Yeah, probably pretty much I found after doing that last lot of training, the mastery training with you, I think just in doing that change of different technique and, you know, focusing sort of more in on that you don't have to, you know, beat a pound of flesh to get some decent result at the end, was, yeah, like, you know, I kind of did start changing and it just was happening. I didn't actually, you know, consciously get there and say, right, I'm going to change how I do this. I just found when I went doing some specific work, particularly probably for people on the neck and the face, I did change a lot of what I did, and probably used some more of those gentle zigzaggy techniques out, and probably did, yeah, a bit more fascial work than what I probably did previously. But yeah, like I've just found even in all my remedial work, doing the planing and doing things that I never did previously, before or during or whatever in a treatment, I tend to find that sometimes you go, oh, I need a bit of that planning done, and you just kind of, you know, zone in, and that's what you do. And yeah, it's sort of, I don't know, probably that connecting back to my clients in a different way than what I've probably done for a long time. Like when I used to do a lot of kinesiology, and only kinesiology at one point, because that was, what people were driving to me for, I suppose. I found probably have gone back to that, being more in tune with what I'm doing in my clients. And when you're really, really busy, which, I am, and I know a lot of other people are, but some days it's quite overwhelming, the busyness of it all. And it actually has helped me sort of, kind of get back in and probably enjoying what you're doing within your work as well most days for me. Yeah, so unintentionally, but probably consciously from the universe, been doing it.
Wonderful. Was there any standout things in the actual online learning course that you did? Any sort of big takeaways for you personally?
Probably one I found it very easy to, schedule that in for myself. In fact, I just said, right, on this day every week for this long, I'm taking this time out. And it probably, by doing that, you're committing to it and forces you to actually say, yes, I'm going to be available. There's a couple of times that, may not have, or one I can't remember directly, but if not, of course, you could watch the stuff. But I just felt that the thing that probably struck me was the videos and the, client consults and connections that you had to actually do in the morning. It was obviously it's very real, and because that was what was happening, but you could actually nearly feel like you were in that session with you because of the, two-way conversation type of thing that it felt was happening for us, even though you were in your room with your partner watching a video, but you still felt like you were actually part of that by the content and the conversations that were happening. And that really helped give a bit of confidence to how to actually have that conversation then with our client or person that we were even doing the training with. And that is probably something a bit different than what I've had before. Sometimes, sticking on a video and just watching something happening, it's very different with the way that you presented it. And I think it, helped ground a bit of the confidence for myself, even though I feel I'm fairly confident in my, consults. Normally you're going into a bit of a different field, and so it is outside your comfort zone sometimes. So to actually have the training that actually helps you just gain a bit of that without a lot of effort in one way is really good.
I wonder, I've got one more question about the actual gentleness of the techniques. Have you had to do much re-education to your clients? Like, are they coming in saying, hi, I want you to break down some scar tissue, I want you to get rid of scar tissue? Like, are you getting much of that?
No.
Cool.
Yes, no, not really. Like, yes, with even the little bit of stuff that I knew way back in the olden days, and doing a bit of stuff then, it was probably more because really sometimes the client comes and they just got a scar or they got pain or whatever, and so they're really coming in sort of handing themselves to you saying, do whatever you can do to kind of assist me, I guess. So it's really probably been more the re-educating of myself in looking at, because when in my earlier days of learning, which is like way back in the 90s, like the 60s, more, but back then it was more about, stripping scars and breaking things down and doing all that. And I think probably reflecting on that, I probably hurt more people than I actually, probably did betterment of, when you think about it. But, obviously something improved for them because they did come back again. But, probably in this is more about re-educating myself and explaining it in a way to the clients. And I probably do it in a bit of a different format than perhaps I think, and it depends on what the person's scar is, to how I might probably explain how that kind of works. You know, I just sort of explain more about that gentleness actually helps with, you know, the integration of what's happening for your body. And then it's quite amazing how you can go from that physical discussion to how do you feel about your scar, and, you know, and then it's just a very gentle flow on from that for how they may talk about whether it was from an accident or the surgery, or, you know, and even for my postnatal mums, you know, some people do go in like we're having a Caesar for a direct reason, and other times it can be an emergency, you know, C-section. And so the whole emotional connotation around that is sometimes it's, well, not sometimes, majority of the times in my experience, it is actually good to help them work through that emotional negatives or whatever around what's happening for them there, to help them obviously in their whole recovery through their postnatal period as well, because, you know, they're the type of things that can impact on things like postnatal depression and stuff like that as well. So it is good if we can get the people coming early to actually also assist in that area as well. Yeah, so probably the re-education is probably being more to myself, identifying that it is about a very light and effective therapy that works extremely well without having to, you know, be too hard on.
I too was using hard, heavy techniques for quite some time, which is why once these other lighter techniques came into my world, I was like, oh, this is something that I really am passionate, want to share with other therapists. And
I know that, you know, I haven't done the hot stone training with you, Chris. Your course is profound from the bits that I've seen and people who have done it. And, you know, sort of I did stone training a long time ago, but I do integrate the use of hot stones in with, well, all of it really.
All of it, yeah.
Certainly with, you know, doing some of the, like even in the treatments of doing the planing and stuff, then, you know, being able to use some hot stone even for abdominal relaxation, and, you know, but even just with helping around some of the areas of some scars that are, you know, the tissues around that is quite knot and hard, but just to have that, you know, heat of the stone, and then to be able to do some of the other technique works that you taught us. I can't remember all their names directly, but you know, when you do
cool. Cool. I think it works with the nervous system. Both of those techniques are nurturing. I think that's the thing. And so it just works with people's nervous systems, and especially in this COVID environment, I think people are, even if they don't feel stressed, they're stressed. The environment we live in has been changed, and that can stress people. So I think anything that can calm down our nervous systems is a good thing. Yeah, cool. Anything else you want to say, or
look, yeah, I don't know. I think of anyone wants to come out and, you know, to my clinic and let's do a bit of scar stuff together, feel free. Yeah, but yeah, I think it's probably the main thing is, yeah, like if you are considering doing the training with you, or anyone considering doing the training with you, I could honestly from the bottom of my heart say it was truly wonderful. I enjoyed doing, I enjoyed learning, I enjoyed the amazement of what, even though I've been doing work for many, many years, yeah, it just sort of changed some of the way that I look at how I need to work to make a difference for someone as well. But yeah, just to be able to learn that stuff that is quite profound for people, and from even the smallest scar to the biggest scar, it's all, yeah, made a difference for clients of mine. in a way that I think they would never have imagined as well. And yeah, like I just say, do it. If you know, where it's yeah, and because it is something that you can use alongside or with what else you're already doing. You know, you don't have to buy any new equipment or reset up your clinic. You literally just still using your hands and your heart and everything in the same way that we do, except we're just changing that to the lightest technique that you can't imagine that is possible to make such a difference for people.
Thank you so much. Thank you. It was a pleasure to have you on the course and the workshop. I mean, we just had so much fun that day. It was a lovely afternoon, the whole day actually that we spent there. It was great.